evening. Good evening, and thank you for joining tonight's Teletown Hall meeting with Congressman Andy Barr. Congressman Barr will be joined by emergency physician Dr. Ryan Stanton. Dr. Stanton has nearly 2 decades of experience and serves on the board of directors for the American College of Emergency Physicians. In just a moment, Congressman Barr and Dr. Stanton will begin with a few remarks to give everyone time to join the call. This technology allows people from around the 6th District to join us live to ask questions from your congressman. If you have a question for Congressman Barr, please press star and then 3 on your phone. Again, that is star and then 3 to join the queue to ask a question. With that, I'll turn it over to Congressman Barr first to update us on the federal response to coronavirus, and then to Dr. Stanton to provide his medical expertise on the coronavirus.
Thank you very much, and good evening, everyone. Thanks so much for joining us for an important update on response efforts connected with the 2019 novel coronavirus or COVID-19 pandemic. I know this is a very difficult time for Americans and for Kentuckians here who are practicing social distancing and trying to stay healthy and taking care of their families, typically at home and off of work or out of school. And obviously there's been a tremendous business interruption and economic interruption that is the result of this public health emergency nationwide. But I do want to stress to you that we're going to be stronger, more resilient on the back end of this, and there's a lot of good that's coming out of this that we can discuss tonight. It's a huge challenge for our country. It's unprecedented in so many ways, but we wanted to take the opportunity to give you information, to equip you and your family and your business to get through this. And we're very, very lucky tonight to be joined by my good friend, Dr. Ryan Stanton. Dr. Stanton, as was said earlier, is an emergency physician. He's on the board of directors for the American College of Emergency Physicians. He has 2 decades of experience, and he's a real leader, not just in the emergency medicine, but you may be familiar with him. He's on television locally here in central Kentucky and is a real resource for all of us and is on the front lines fighting this pandemic with many other selfless and skilled doctors, nurses, and healthcare professionals. And I want to thank Ryan and his colleagues in hospitals across central Kentucky who are doing great work. And really, if you think about it, they're putting their own health and the health of their families at risk to serve patients and to heal the sick during this difficult time. And also want to thank the first responders and the public servants who are also working very hard during this pandemic. This is our third Teletown Hall that we've conducted since the outbreak really began. And with my support since this all started, Congress has taken historic action to pass 3 phases of fiscal relief, fiscal stimulus in response to this pandemic. The third phase of that was the Coronavirus Aid, Relief, and Economic Security Act. This is the boldest, most aggressive fiscal relief package in American history. Instead of flying, I drove up to Washington last week, cast my vote in favor of this $2.2 trillion aggressive stimulus legislation, and then drove home. What I will tell you briefly, and we can talk more in answering questions about the legislation, but I am very confident that this legislation will support the work of the doctors, the healthcare workers, the first responders in Kentucky and across America as they combat this disease on the front lines. It will embolden our researchers, our scientists, our pharmaceutical companies to find therapies to fight and ultimately defeat the virus. And more specifically, it builds on the emergency supplemental, the phase 1, by allocating an additional $4.3 billion to the Centers for Disease Control, $16 billion for the Strategic National Stockpile for Personal Protective Equipment to procure essential and life-saving PPE for our frontline healthcare workers. I will touch more on the shortages in PPE and what we're doing to address that later in this call. Additionally, the CARES Act provides small businesses, workers, and families in Kentucky with the capital and the cash flow that they desperately need to pay their bills and face the economic challenges posed by this virus. We're really not in a conventional recession. We're in an intentional, deliberate shutdown of the economy to respond to the public health emergency. You can't engage in the social distancing that is required without basically shutting down wide swaths of the U.S. economy. And so to compensate for that, the CARES Act makes sure that Americans will receive direct cash assistance in the amount of $1,200 for individuals and $2,400 for couples who file their taxes jointly. And that's for income at or below $75,000 for individuals, and it begins to phase out for couples with income at or below $150,000. Beneficiaries will also receive an additional $500 per child if they have children, and all of these amounts completely phase out at $99,000 per individual and $198,000 for couples. And finally, this legislation will help businesses of all sizes stay afloat. And in particular, there is a paycheck protection forgivable loan program that encourages employers to retain their workforce and come out strong on the other end of this crisis. It will create a small business loan program, 100% guaranteed by the government, facilitated by businesses, existing banks, and private lenders across the country that will provide short-term relief as businesses weather this crisis. It's fully forgivable as long as those employers retain their payroll. My office has established a small business response team to address the concerns of our Main Street businesses. We're working with lenders, banks, credit unions, non-bank lenders, as they are delegated the authority to push out this liquidity into our Main Street economy. We will help you, and if you are a small business owner, if you're an employer, we can help direct you to the resources you need. We know that you are critical to middle income and low income workers across our district to keep them employed, and so we will be happy to help you find the resources you need that's provided in the CARES Act and also other legislation recently enacted by Congress to combat COVID-19. Anthony Allen in my Lexington office is leading the effort, and you can reach him at 859-219-1366. That's 859-219-1366 if you have questions about the small business funding that is included in this package and that may not be completely covered in this call. And as a reminder, for those of you joining the call, you can get into the queue to ask a question by pressing *3 on your phone. You'll be put through to an operator. You'll be placed in line to ask a question. Now to give you a brief update on COVID-19 cases nationwide and in Kentucky. As of 6:30 p.m. Last night, Tuesday, March the 31st, 200,000 Americans had tested positive for COVID-19. We've tested well over 1 million Americans now, more than 600 confirmed cases in Kentucky. At this point in time, Kentucky accounts for less than 1% of all confirmed COVID cases nationwide. This is a good sign, but it's vitally important that Kentuckians remain vigilant and that leaders continue to prepare our state for more cases to rise. We can anticipate, based on the modeling provided by Dr. Fauci, Anthony Fauci at the National Institutes of Health, that we can expect to see a very significant spike in confirmed cases and mortality rates over the next 2 weeks. Since the beginning of this pandemic, I've been working diligently to secure vital resources for Kentucky to fight the virus. Last week, I joined my colleagues in the Kentucky delegation in support of Kentucky's FEMA disaster designation request, and the President approved this request on Saturday, giving the Commonwealth access to additional federal funding and resources to combat the pandemic. We've also been coordinating and advocating with FEMA, HHS, the Assistant Secretary for Preparedness and Response, to ensure that Kentucky has received as many medical supplies to our hospitals and healthcare workers as possible. As of today, we've received 3 shipments of resupply of PPE from the National Strategic Stockpile, and that includes shipments of 41,744 N95 masks, 99,000 surgical masks, 18,900 face shields, 15,439 surgical gowns, 55,000 gloves, and then that same shipment was replenished with the exact same numbers of those same material on March the 24th. And then on March 30th, Kentucky received 60,000 N95 masks, over 143,000 surgical masks, over 31,000 face shields, over 25,000 surgical gowns, 1,700 coveralls, and 184,000 gloves. Additionally, I led a bipartisan letter with Congressman John Yarmouth to cut red tape at the FDA and allow our bourbon distilleries to produce more hand sanitizer with their alcohol. Our letter has 87 members of Congress as co-signers, and I'm confident that we will defeat this virus. But I recognize the emotional and economic hardship that this pandemic has created for Kentuckians and Americans across our nation. We're going to continue our efforts to protect our state, our people, and ensure that the great American comeback is on the horizon. And it's going to be engineered by the actions we take now during these difficult moments. I continue to seek your feedback and ideas, and I will continue to advocate for your interest in the course of this crisis. But I want to now turn it over to Dr. Ryan Stanton for his remarks. He's on the line for his healthcare expertise and can answer more about the health aspects of this, whereas I can talk more about the federal response. So thank you, Ryan, for your time and expertise. I know you are working overtime to treat patients, so it's really good of you to give us your time. And please go ahead and give us your thoughts on where we are in this crisis right now.
Yeah, Congressman, I appreciate it. Actually wrapping up a shift right just before we got started here, picked up a couple of extra to protect some of our older physicians to try to prevent their exposure to the virus, because we know how it impacts the population as you get more calendars behind you. And to give you an idea of where we are with this virus, this is the first time I've seen healthcare scared. Physicians are scared, nurses are scared. Everybody's still going in and doing their jobs, but they understand they're putting their life and safety and families at risk for this. And so, even I thought a month ago this wasn't going to be a huge deal in the United States. We've seen a ton of these viruses come and go and never really impact the United States, but this one clearly had what it took to make it over here and really spread. And it could easily be the worst infectious issue facing our country in the last 200 years if left unchecked. I think everybody always references the 1919 Spanish flu, but for this, if it weren't for steps, we would see likely millions of Americans and probably tens of thousands of Kentuckians die from this. But we've made good steps, and we've made a lot of good steps with social distancing. And the congressman mentioned the likely peak in 2 weeks. Well, that's areas like New York are going to peak in about a week. And the more steps you took ahead of time, the farther it pushed the peak back. So for Kentucky right now, we're looking at a peak somewhere in early to mid-May. And that may be frustrating in that it's that far, but it also means the curve is quite flat, meaning if the current projections continue and all of our citizens continue to do the things we need to do, then we will never, here in Kentucky, expend our resources for healthcare in terms of beds, ICUs, and ventilators, which is huge. We don't want to end up with the decisions like Italy has had to make, but this has definitely upended the medical system. It's uncovered a lot of issues that we have in terms of availability of PPE, ventilators, where we've started working in healthcare to try to be, we've really pushed the last couple of decades on lean technology, meaning, kind of trying to use what you need to where you don't have a lot of stockpile and reserves in order to make it more cost efficient. Well, when you have a pandemic, that doesn't work out very well, and we're seeing the issue when the entire world is impacted. It's very hard to catch back up. I see a lot of people still online talking about the fact that the numbers of the deaths and flu and comparisons, and I want to make sure everybody realizes the flu is the most recurring and deadly of our viral illnesses that we see every year. But the risk of flu is so much smaller. We'll see 20 to 60,000 deaths. The conservative death estimates right now for this one, even with all the steps taken across the country, are somewhere near 100,000 and possibly even more than that, pushing closer to 200,000 or 250,000 deaths across the United States. And to get an idea of how contagious this is and why social distancing is so important, The R naught, or the infectivity of this virus, is somewhere between 2 and 3. That for flu is between 1 and 2, and actually about 1.3. So what does that mean? The R naught means that if I use 3 on this virus, for every person that gets it, they will spread it to 3 other people. They will spread it to three people. They will spread it to 3 people. And with the average of 5 to 8 days before symptoms develop in between when they transmit it to other people, that means if one person gets this virus, within 1 month, we'll probably have about 40 people with the virus. So even decreasing that exposure to one person makes an exponential difference in the number of people that have that. With a flu number closer to 1, one person gets it, one person gets it, one person gets it. So it's a very slow relative spread. In Kentucky here, again, we're looking at a peak somewhere around the first and second week of May. It's bouncing around a little bit. The expectation in Kentucky is probably somewhere between 800 and 1,000 deaths potentially, looking at some of the mathematic projections based on how it's behaved so far. And I can tell you from working in the emergency department, we are seeing a lot of cases and a lot more that are presumptive than the numbers show. So I think it's probably just a scratch in the surface of the numbers that we're seeing broadcast of positive cases, that it's much more community. So we all have to take those steps. And I know it's very inconvenient to people right now. In fact, it's probably threatening some livelihoods out there. But this is something that if we don't check it right now and do the steps, we will lose friends, family, the relatives, those close to us, healthcare workers, first responders. This is a huge threat. And for this inconvenience, we will save hundreds, if not thousands, of lives. So, this is one of those situations where hopefully by early fall, we can say that we are done with it. And other than some mild, and a few cases here and there, we'll be done with it. But I look forward to pushing this back as far as possible so we have the technology, the medications, the treatments, and eventually the vaccine. Last I heard, there are 15 vaccines under investigation right now, and I think we'll likely see something coming up getting into early next year. So thank you for everybody for doing the things and making the sacrifices you need to make, and I'll turn it back over to the Congressman for questions.
Thanks so much, Ryan.
Thank you, Congressman and Dr. Stanton. As a reminder, and for those of you just joining the call, you can get in the queue to ask a question by pressing *3 on your phone. You'll be put through to an operator, and you'll be placed in line to ask a question. Again, that's star and then 3. With that, we'll open it up for questions. Again, if you would like to ask a question, please press *3 on your phone.
And we've got a lot of questions. We're going to go straight to the questions. But before we do, I just wanted to mention that Congress and the President are receiving very good counsel from the former FDA Commissioner, Dr. Scott Gottlieb, on a national coronavirus response roadmap for reopening our economy. And so often I get that question, well, when will we see the peak? When will we be able to see a roadmap for reopening? I'm happy to tell any of you all, if you've got that question about what Dr. Gottlieb is recommending in terms of that roadmap. But the first phase of this is really about better data to identify areas of spread, to contain the spread, to slow the spread, to do all the things that Dr. Stanton was talking about, to stand up a sentinel surveillance system, and make sure that the resiliency of our healthcare system with PPE and with diagnostic testing is much stronger than it is today. We can get there within a matter of weeks, but that phase 1 is what we're working on right now.
Okay, and now for our first caller, Andrea in Nicholasville. You are live.
Hello.
Hey, Andrea, how are you?
I'm good. How are you? Thanks for all you're doing.
Thank you.
So my question is, there's been a lot in the news as far as different surfaces. I guess this is more so a medical question. Different surfaces and how long it stays on a particular surface, metal, wood, whatever it may be, paper. I was wondering if someone could confirm anything about, actually what we do know as far as how long it stays on there.
Yeah, okay, so good question, Andrea. And so, Dr. Stanton, how long does the virus stay on various surfaces? Wood, paper, flooring, tables?
Yeah,
plastic?
so I think there's a lot of questions because then we get the cruise ship that shows that there was still virus after 17 days. But most data is showing that it'll survive on most surfaces, the steel, wood, those sorts of things for about 3 days. And then plastic, the plastic very similar. Things like copper, it's shorter, about a day. There's some data that it may survive for about 3 hours in the air. Now, that was a study done in a perfect environment that we're not going to get. I mean, it's basically, controlled, no circulation, anything like that. But we have to assume that it's there. The good thing about this virus is it's not very rough when it comes to resisting cleaning. It dies with soap and water. It's easily washed off. It does not. It's killed very easily with bleach solutions and things like that. So it's very susceptible to cleaning. And that's one of the big things we've talked about with folks, is the importance of washing your hands with soap and water, hand sanitizer if you can get it in between. And then on the final is making sure you wash all your surfaces. So when I come into the emergency department now, before every shift, I take a bleach wipe and I clean the entire surface, the desk, the keyboard, the phones, my phone, everything else that's in there that I'll be touching, including the arms of the chair. And people need to be doing that on a pretty regular basis, because you don't know, especially if you happen to get out and about. We'll just say going to do your grocery shopping and you have your grocery cart there, that a day or two before somebody may have touched that had COVID. So you want to make sure you clean that. And a lot of these establishments are taking extra steps in cleaning them for you and doing things, but don't assume anything. Just make sure you clean all those surfaces that you're going to be around, and do them frequently. And don't forget your phone, don't forget your keyboard, and don't forget those doorknobs, because those are places that this thing likes to hang out.
Thanks a lot, Ryan.
All right.
Our next question comes from Carl in Lexington.
Hello, Carl.
Good afternoon, Representative Barr. How are you this evening?
Well, I'm doing okay. Hope you're healthy as well.
Getting over a little case of the flu, but actually your call was quite timely. I think I've left some information with your staff, but we want to know how I can get a hold of people to find out. We have a potential ventilator available that we can build very quickly, and a lot of them for the state if necessary, as well as anybody else that might need them. It's a very simple device that can keep somebody alive for a period of time, and at the end you can throw them away. They're not very expensive.
Well, thank you so much. And is your manufacturing facility here in Lexington?
It is actually located in Georgetown. We're a bunch of ex-Toyota engineers, and so we've come up with a method to be able to do it. We just don't know who to get to. Okay.
Well, let me give you a couple of things. And I know you're in contact with my staff, and so maybe they're giving you this information as well. But there's a government agency called BARDA, and that we want you to submit your proposal to. It's medicalcountermeasures.gov is the website, medicalcountermeasures.gov, and /APP/BARDA, B-A-R-D-A, COVID. So it's if you just go to that medical countermeasures, you can get to it and submit your information there. And then what I will do is that's a portal that'll there's a lot of companies that have submitted their ideas online, but I want to get your idea special attention. So if you could contact our office and whoever you're talking to, Anthony or whoever you're talking to, make sure you give them all of the details in a one-pager, and I will forward that to the Vice President's office, and reference the fact that you all have submitted your information to the BARDA website.
Okay, dynamite.
Yeah, and I am in daily contact with the Vice President's office. The Vice President is leading the White House task force, and we need you, and we are so grateful to you and so many other private sector entities that are stepping up and wanting to help in this fight.
Well, we are here to help any way that we can, and just let us know what we can do, and we'll try and figure something out.
Yes, sir. And we're getting your phone number right now. We've got your phone number, so we will be right in touch with you, Carl.
Great. Thank you, Representative Barr. I appreciate it, and I appreciate everything that you all are doing to try and keep us all safe.
Well, thank you, too. Thanks so much. And hope you feel
Congressman,
better.
can I interject there?
Sure, go ahead.
Yeah, so that he actually brought up an incredible thing that I've never seen in the history of my time in healthcare, and I don't know that we've seen in terms of mobilization since World War II, and that's the private sector jumping in. Whether it's what he's talking about, people creating and building these ventilators, or just as simple as we've got Lexmark here in town that has been laser cutting shields for our masks because there weren't enough of the mask shields. The public are getting involved in terms of the private industry, folks that are used to be making whatever they're going to be making, but coming together and making stuff for healthcare has been really impressive and really amazing, and maybe one of the shining moments of this pandemic is seeing the private sector jump in and come up with solutions to the healthcare shortages that we're seeing right now.
Absolutely, and we're seeing it with ramping up and spinning up the production of PPE with the domestic production, and I'll also note that the antivirals and the therapies that are in clinical trials right now, very promising. In phase 1 of our response, we appropriated over $4 billion to FDA and CDC, HHS to help the development and the quick approvals of not just the diagnostics, and we've approved over 20 different diagnostic tests now, but also these therapies. And as we look towards the roadmap for reopening our country, we need to have that tool of therapies early in the summertime, which we hope to have validated through some clinical trials. And we already have a vaccine or several vaccines that are in active research and clinical trials as well. Johnson & Johnson announced they're getting their highly promising vaccine in a trial. So we are making progress, and the private sector is a big part of it. When I say BARDA, just for those on the call and for Carl, that's an agency within the government called the Biomedical Advanced Research and Development Authority, and they have a coronavirus portal. And so if anybody wants to contribute, has an idea, you submit that through there and then use my office to highlight it for the White House Task Force.
Thank you. Our next question is from Theta in Georgetown.
Hi, Representative Barr. I'm sick. I guess the question is towards the doctor. For the past 3 weeks, I have been trying to get tested. My doctors have been referring me to the ERs in Lexington. And because I'm not running a fever, I have not been tested. So this is the third time I was sent to the ER again today by my doctor through telehealth. Went to the Baptist House ER. And it's like, I don't know if there's not an open line of communication, like, why am I here? Why do they not send me somewhere else? Because I was now running a mild temperature. I am now running a mild temperature, but today I was finally tested for the coronavirus, and I was tested twice because they tested me also for the state lab and also for LabCorp, and I guess I didn't meet the criteria for the state lab, so I can get results back within 2 days or 48 hours. I guess that's correct. But now I have to self-quarantine for, 14 days. But the doctors will keep saying that they still don't have, they're not testing a lot because they still don't have what they need in the hospital or the ER to test. But I've been at this for like 3 weeks now, almost going on my 4th week I've been going through this, but I have self-quarantined myself since March the 16th. I mean, I guess I need to know what I need to do moving forward and why still the hospitals are saying are not communicating with the doctors in the office. Everybody's not communicating effectively about, the test that we should I should be going somewhere else to be tested instead of the ER.
Well, the issue, one of the big issues is you're absolutely right, and it's as frustrating for us as it is for you that we don't have access to where we can test everybody. I would love to test everybody because I think then we would understand really how diffuse this virus really is and how many people have it and may be asymptomatic or at least mild symptoms. And so I understand your frustration. The one thing with this is a lot of people and a lot of the clinics and things, they want to avoid potential exposure. So a lot of times it is referring to the emergency department. The state is very limited in terms. I've actually talked to Dr. Stack. We're good friends. And I talked to him several times about it, and he says, listen, the state is not just any state. It's not made to be doing these types of testing on a wide spectrum. Now, confirming, that's a different story. But we're seeing we've gone from 0 to tests within just a couple or a few months, which is really remarkable. But the problem is now getting those tests to every single hospital around the country, and then the timing of those tests, ensuring that they're sensitive and specific. The problem that we're seeing now is not only are some of the tests taking a long time, the one I think you're referencing was supposed to be 4 to 6 days and is now running 10 to 14 days because of the number of tests they're running behind. And each hospital doesn't have all the same material, have all the same tests available. And I'm hoping, you mentioned one of the hospitals here in town. I'm hoping that hospital has the faster test here within about a week. That's what I'm hearing. But some of the other hospitals and facilities have different things, the potential of drive-throughs. I think we're about 1 to 2 weeks from probably having pretty widespread testing of about anybody who needs to be tested. But I share your frustration, and I wish in my emergency department, in any of the emergency departments that I've talked to working with the American College of Emergency Physicians around the country, that's a frustration we all share, is that we want to be able to test these folks that are coming in and get the results back in real time, because 14 days is not really that helpful, especially since a lot of these are getting false negatives, meaning you may have it and they're not actually picking it up. So that's something that we're working towards, and I think Representative Barr may have some, because we talked about this a little bit before the call started, some of the things that are out there, some pushes to get some of these more tests available and in the hands here in Kentucky as soon as possible. I'd love to see it.
Yeah, and Theda, best wishes to you. I know you're struggling with illness right now, and we hope you don't get a positive result, but the lag time in testing is totally unacceptable. And although we've had 20 emergency use authorizations by the FDA, which is good. That's actually better than the FDA normally is in terms of speeding approvals and validating the reliability of tests. We still are behind the curve because there's been this surge of illness in the country, and there's so many people who want to get testing. We will not get to phase 2 in the roadmap to reopening our economy until we have a lot more diagnostics available. What the task force is telling us is that now we are testing 100,000 a day in the United States, but I'm not seeing the rapid testing in the hospitals and in the doctor's offices, and that's where we need them. It's certainly not in central Kentucky. And so I put in another call to the Vice President's office just before this call, and my contact there is he's getting me in touch with their team, and hopefully we'll get an update on not just getting more tests approved, but actually getting the fast throughput tests in the hospitals themselves, so that Theda, a patient like you, can get a test result within minutes, or at least a few hours, as opposed to waiting days and even weeks for your result.
Thank you.
Okay, our next question is from Sharon in Wolf County.
Hi. I've heard, on the TV and everything that if you're like over 60 and have pre-existing conditions, you should stay home and take extra precaution because it's hitting that age group bad with deadlier results. What if you're a nurse?
That's a great question. That's what, yeah, and a lot of hospitals.
I am a nurse, and my program was shut down, and I thought I would be furloughed with everyone else that was shut down in that program. But instead, I'm getting reassigned and stuck out front to meet people with the thermometer, of course.
The most important thing is to make sure you wear the proper PPE. Hopefully the hospital or facility is providing that for you. It's one of those things that, yes, and it's a consideration we have in our hospital, in my facility, and I just mentioned was working today, and I'm going to work tomorrow to fill in for one of our physicians that's 70 to try to decrease his potential exposure. But at the same time, with proper PPE and precautions, your risk of transmission is still quite low. I think you're much more likely to have potential community-based exposure. Now, if you have concerns, bringing that up with the staff and facility there, making sure that you have the proper PPE. OSHA is been very supportive of healthcare folks to make sure they have the right stuff and the right to wear the things they need to wear. But then making sure that you take the proper steps to, when you get done, when you go to the hospital, change in the hospital scrubs. Before you leave, change out of the hospital scrubs. As soon as you get home, taking a shower, doing those types of things, you do have a slightly increased risk with other comorbid conditions, but especially when we get that above 65, 75 years old, that risk really does jump up. But it is one of the challenges that we're facing with our healthcare professionals is healthcare professionals are going to be a disproportion of those exposed and potential complications worldwide, and we're trying to prevent that here in the U.S. But the key is going to be that PPE and taking your steps to decrease that potential exposure, though nothing is perfect.
Well, that's true. Nothing is perfect, but I feel like the pre-existing conditions that I have would really put me in high risk because I've had cancer twice, and I have to use a CPAP at night and things like this. But when I try to speak with the people above me, I'll not say any names, but anyways, I get nowhere. I get almost like blowed off, as I don't know how else to say that. Like it's not important. Like I'm not an important person here. It doesn't matter because I'm a nurse. I have to do it anyway.
Oh, Ms. Combs, this is Andy Barr. If it's okay with you, we have your phone number, and I'd love to reach out with you and see if we can help you, okay?
I would love that, too. Thank you very much.
Yes, ma'am. We'll give you a call. We've got your number. We'll give you a call and definitely reach out to me, too, if you don't hear for whatever reason. But we will call you at this number and see if we can help you navigate that difficult situation, okay?
Thank you very much.
Yes, ma'am.
Okay, our next call is from Diane in Versailles.
Hello, Congressman. I have a couple of issues. I am very concerned about gas pumps because they're one of the germiest things there is around anyway. Now, I understand I must have missed it, but Governor Beshear, one of his first speakings, he mentioned it, but they don't continue to mention that. But stop and think about how germy gas pumps are, and everybody's getting gas. If people could carry hand sanitizer with them, as soon as they hang that pump up, use it on their hands before they even touch their door handles or their steering wheel, I think that would be very beneficial. And I think this needs to be brought up on a federal level when Trump and the team gets up there and talks, and also here in Kentucky. Another thing, I know the Kroger's here in Versailles, and they don't observe the keeping distance list. I know they're short of help, but they ought to really stress that in these stores because the people get right up next to each other rather than keeping the distance. if something could be done where the stores would make them keep the distance. And I understand some churches are still holding services. I feel that needs to be stopped. But
well, thanks for the question. Dr. Stanton, you have a suggestion on the gas pumps for Diane?
Actually, I saw this, and this was kind of a, kind of one of those life hack moments that folks had brought up. And one thing that people have, now, not only having some hand sanitizer with you, that's fantastic, is the potential of actually using like a plastic grocery bag to grab the handle and then place it in, then use to put it back and then throw the bag away. That is one option if you're not going to actually clean it and sterilize it before you go. Or the other option being that you use the pump and understand that risk and then use the hand sanitizer or go wash your hands before you get back into your car, because I agree that is one of those surfaces that has the potential to hold on to those germs and transmit them. So I would treat that like anything else. Either sterilize it, use a barrier, or clean your hands after doing that. And I actually did that exact thing yesterday when I was getting gas, heading down near Stanford. Filled up with gas, and as soon as I was done, I went in, washed my hands, and then used hand sanitizer on top of that. So just be aware, and I'm glad you're aware of that, because I think a lot of people aren't thinking about those types of things when they're out and about during the day.
Many places, like at Kroger's, there's no place to go wash your hands, and you're still taking a chance on touching more stuff. And if people had the hand sanitizer and used it as soon as they hung the pup up before they even touched their doorknob, if we could just get more of that out in the public, on the federal level and on the state level, and just like keeping their distance like in the grocery stores. Because, people are just right on top of each other. They're not paying attention about the distance. And, and it's silly for churches to hold church, that's spreading it. And
Thank you, Diane, and those are all very, very good points, and we appreciate the call, and I think that was very helpful for everybody to hear.
Okay, our next caller is Lee from Lexington.
Thank you, Representative Barr. My question is about the required minimum distribution that has to be taken every year from 401ks and IRAs. And in view of the fact that those things are really being hit by the stock market and et cetera, I was just wondering, it was rumored that might be eliminated this year, just for this year. Can you speak to that?
Yes, sir. Yes, we recognize that, especially for retirees, with that required mandatory minimum distribution, that it's really not fair given the hit that the stock market has taken to make you take that distribution. So the legislation that we just passed and that is now law, the CARES Act, provides that older Americans, retirees that are subject to the mandatory minimum distributions from their retirement accounts are able to keep their capital invested instead of being forced to cash out to draw on that capital and take a loss. And you can keep that invested without penalty. So that is that penalty provision is suspended for 2020. So you do not have to take out that mandatory minimum distribution. You don't have to take a loss on your retirement given the decline in the stock market, and you will not have a penalty for keeping that invested. So that is good news. Also, I would mention for folks who are not yet retired, but who are having a cash flow issue given the interruption of so many businesses and jobs right now, the legislation also waives the 10% penalty on coronavirus-related early distributions from 401ks and IRAs. So normally you would have to pay a penalty if you take an early distribution, but not this year under this new law. So if you need to tap into your retirement, that's not the best option available, but if it's the only option you have, this bill will waive the 10% penalty for an early distribution up to $100,000, and that applies to distributions made at any time during 2020, and then you'll have 3 years over which you can recontribute that back into your account to replenish your retirement so that you can draw on that retirement penalty-free short term.
Our next question is from James in Winchester.
Barr, first I'd like to thank you personally. I've worked with you in the past several times, and a lot of people don't understand how much work that you're putting in, as well as Governor Beshear. I mean, you two have really come to the plate for, the state of Kentucky. All you got to do is look at the other states like New York and Connecticut, and you see a huge difference. My question is for, Dr. Stanton. Dr. Stanton, I'm pretty sure, based upon all the criteria for the coronavirus, that we, in my household, me and my wife, had it in February. I travel extensively for work supporting troops, and came home with all the symptoms, every single one of them that it names. I went to my local doctor. They did put me on antibiotics. I did have a productive cough from the chest, the low-grade fever, everything. Now that I'm pretty confident I'm over everything, I would like to get tested so that way you could use my antibodies if possible. Is there, something I should do, to make that happen?
Well, right now the antibody testing is still in its infancy because that is the real thing that we need, is to be able to test the antibodies, because I completely agree with you. I think we probably had pretty good community spread way back in February and potentially in January as well. You don't see something like this pop up in all 50 states within a week or so with it just coming into the country. So it was here. And I agree that I think the antibody testing is going to be something that's going to make a huge difference, especially for us in healthcare, to understand if we've actually built antibodies to it without developing symptoms, because that'll be huge to understand how safe you are around patients that have it. But right now, in terms of your question of being able to use those antibodies, I think there's a lot out there. The one good thing that's happened, one of the many good things that have happened, is that the genome and the breakdown of this virus was well before it even got to the United States. They knew almost everything about it and really digging into it further. And so we're at to the point now of already human testing on a number of vaccines, looking at the treatments and seeing if there's anything that can be beneficial. Unfortunately, viruses don't tend to respond very well to many treatments. And, the thing is for you, is to potentially consider, once it becomes available, getting those antibody tests to see if you've had it, if your body has built an immune response to it, to kind of see, what susceptibility you may have and the vaccine type stuff moving forward, because that will be a consideration as we move forward as to how much of an immune response we build and how long that lasts with relation to a potential vaccine versus just exposure.
Okay. And I am an A positive, so I know they use my blood a lot, particularly when I donate. And the other part is that where I was retired military, we had the malaria pills, pretty much thrown down our throat constantly everywhere we went, all over the world. So I think there might be a little something there, and I just want to see what I can do to help out. And
yes, so you've had a lot of exposure to that hydrochloroquine back in the malaria treatment. So that's one of those things that's being investigated, and we'll see if it pans out. Unfortunately, we're having a lot of theories on treatments, but we're just now starting to get the data and some of the research out there to show if it really will be beneficial for treatments.
And James, thanks for your service to the country, and stay in touch with our office as you read in the news development of the antibody tests. Reach back out to us when that becomes more widely available, and we'll try to connect you if you can't connect on your own.
Hey, our next question is from Joseph in Lexington.
Hey, Congressman, thank you so much for doing this.
Yes, sir. Hope you're well.
I am disabled, and I'm also in one of the risk categories due to cardiology problems. And
okay.
For the last 48 hours, I've been calling and searching and kind of driving myself crazy because I don't have anything else to do on this benefit payout how does it reach people who are on Social Security like me, who've been on it for several years and who haven't filed tax returns?
Yeah.
I've gone to the IRS website and tried to file electronically, and it won't allow me to do so since I haven't filed in previous years.
Well, we will help you, sir, Mr. Patrick. Here's how it's supposed to work. So, Section 2201 of the bill is the section on the rebates, and you're right. You are eligible. All you need is a Social Security number, and you are eligible even for folks who do not have income, as well as those whose income comes entirely from non-taxable means-tested benefit programs such as SSI, or if you've got disability, Social Security. So the Social Security number is what you need, and you have that. So what I would propose is for you to contact our office, and we've also got your phone number. We'll reach out to you. For those taxpayers who have bank account information on file with the Internal Revenue Service, that will be sufficient to give an electronic deposit into an account. For you, since you don't have that on file with the IRS, there's a simple piece of paperwork that the IRS is going to produce that will allow you to fill out that paperwork and submit it in order to get a check in the mail. To my knowledge, the IRS has not yet produced that document, but we will help you fill that out. We'll help get that to you so you can fill that out. And for anybody else who's listening on the call, if you don't have your checking account on file with the IRS, you will not be getting a direct deposit. You'll need to fill out that paperwork in order to get a check, just like a return, just like a tax return that you have to file. So anyone on the call who's hearing that, we'd be happy to help you with that as well. And our phone number in the office here in Lexington is area code 859-219-1366.
Okay, our next question is from David in Winchester.
Oh, hi. I think I'm David from Winchester.
Yes, hi, David.
The thing that I had one question, a couple of them really. I'm a retired biologist and with the U.S. Fish and Wildlife Service, and I was wondering if federal retirees are eligible for any of this relief money, or if, since I'm already being paid by the federal government through my annuity, if I am ineligible.
Good question. We can double check that for you, but everything that I've read in the statute and in the summaries of this legislation says that if you've got if you have a work eligible Social Security number and you meet the income limitations, so for individuals, $75,000 in adjusted gross income or less, you'll get $1,200, and that phases out up to $99,000. If you're a married couple filing jointly, it's $2,400. But if you like check for you to double check and get you that paperwork just to make sure, we'd be happy to do that for you.
Okay, our next question is from Kevin in Winchester.
Yes, sir. Thank you for talking to me. I was wondering, I have had bronchitis once a year since age 8, I guess. and I know what it feels like, but I've just had a couple of different symptoms come up over the past couple of days. I have a FaceTime with my doctor tomorrow. I was wondering, I also have primary progressive MS, so I have an underlying condition. I was just wondering, should I be tested? Does the primary care physician have the tests yet, or do I have to go to a certain emergency room, or what exactly I can do?
That's a great question, and it depends. There are a couple of primary care out there that have access, but for the most part, there's a couple. The first and foremost I would start with is the state number, because they may be able to provide that for you. But the question is the risk versus benefit, because this virus has everything from no symptoms to the most life-threatening symptoms and everything in between. There is no clear and easy screening for this virus. And so if you can get access to screening, yes, I think that's good. But really, there really is no treatment available for it. So I would talk with your doctor, but at the same time also don't put yourself in a higher risk situation where you may be exposed to it, especially you mentioned MS, is that correct? Is that what I heard you say? Well, if that's the case. I mean, it's one of those
or
things where,
an emergency room would
well, the problem with
scare me.
Yeah, the problem with the emergency department is, one, we don't have access to ready screening across, just most of the emergency departments do not. And also with the potential in the emergency department, it's getting exposed there as well, because we have a number of likely COVIDs at any given moment in the emergency department. So we're trying to protect folks, especially with conditions like yours, to prevent them from being exposed to those potential things. So talk with your doctor tomorrow. I think that is fantastic. That telehealth has been a huge turn that's come from this. It's really been fueled. Talk with them.
I totally concur.
Yeah, see what it keeps you in your home, keeps you a lot safer. But talk with them and see what they have access to and what they recommend. We're trying to work with a lot of the primary care doctors, but of course, as you heard from Georgetown earlier,
correct.
It's sometimes a little bit unclear. Every few days we have a new test that pops up in our emergency department that's somewhat available but very limited, and we're saving a lot of those for the inpatient setting, so it may not happen. So make sure you have a plan before you leave the house and go to any healthcare setting. And I think that first plan for you is that telehealth conference tomorrow, in order to kind of get those symptoms and see what the options are through your primary physician.
And Dr. Stanton, on that point, the telehealth, we've been working with CMS, the Centers for Medicare and Medicaid Services, the agency of the federal government that reimburses for Medicare and Medicaid, and we've really pushed Seema Verma, the administrator there, to change the regulations, and she has done so to expand coverage for telehealth. That is really, really important for a couple of reasons. Number one, for Kevin, I believe his name is Kevin, the gentleman who was just on, who really shouldn't be venturing out and stay in as much as possible given his health conditions, his pre-existing conditions. The other thing is in-hospital telehealth to preserve, number one, to protect healthcare providers with COVID-positive patients when they don't actually have to be physically present, and also to, frankly, just to conserve PPE. We can conserve a lot of personal protective equipment, what some of your colleagues will call PPE stewardship, if we're able to allow for more telemedicine, and we're pushing the federal government to accept more telehealth and make that reimbursable.
Okay, our next question is from Pam in Lexington.
Thank you so much for having these calls. I knew you when you were a young man, and you were a fine young man, and I know you now of the wonderful job you're doing. I want to thank you for all the work all of you are pushing to get our drugs back into this country instead of being made in other countries. That is just awesome that you're doing that. My question is, there's two. One has to do with the encouraging of people to be safe, and if we do go out for walks, or with the increased, the May being the surge for all of this, should people purchase masks, not the 95 ones, but should, just for safety, should we order the generic mask to wear, since we're saying this is in the air floating around more? Because I don't think people have been thinking about doing that, because the ones for the hospitals are so in demand. I just didn't know about a regular mask, if we should purchase those for our children and families. That's my first question.
Yeah, for the first question, it's actually just the opposite. There's been some discussion on whether people in public should wear a mask, but it's not necessarily to prevent you from getting it. It's really more for the asymptomatic to prevent spreading it, because those general masks, they don't prevent a lot from going in, but they really are made to deflect what is coming out in terms of the droplets and the aerosolized. So the suggestion may be to decrease the potential of the asymptomatic or minimally symptomatic from spreading it to others. And I think there's a lot of options out there, the cloth masks, the non-medical related type masks out there to help people in that situation. But really, those masks won't prevent you from getting it, especially if it's aerosolized. Where you're likely to get it in terms of contact is either close contact with somebody where you're exposed to the droplets and aerosolized, or really more likely is from the surfaces where we touch it, and then people don't realize how often they touch their face in any given day or even any given hour, are actually being exposed and then introducing it to their eyes or their mouth or their nose or wherever they may be. So in terms of protecting yourself, it's probably not going to add much, but there is consideration that's been coming out from the federal government side over the last couple of days on whether people should wear even the homemade cloth versions to help protect the healthcare access to masks out and about. So if you aren't aware that you have it, that you don't spread it to others.
And Dr. Stanton, if I could just take a stab at that as well, because I was on the call. I was on a conference call just earlier this morning with Dr. Anthony Fauci, with other members of Congress, and this very question was asked. And of course, Dr. Fauci is leading the effort as the director of the National Institutes for Allergy and Infectious Disease on the White House Task Force. And you know, what he told us was exactly what you said. I mean, he corroborated exactly what Dr. Stanton was saying. But they are saying that right now they're not encouraging the public to wear masks because there's such a scarcity of personal protective equipment, and that needs to continue to be reserved for healthcare workers until supplies are sufficient for them and are abundant. So right now, members of the general public is encouraged to be pretty conservative about it. But if you can wear non-medical fabric face masks when going out in public in a way that doesn't take away from healthcare workers, you're encouraged to do that. In fact, in the roadmap to reopen, it is recommended by Dr. Scott Gottlieb that there is emerging evidence, and Dr. Fauci also said this as well. There is emerging evidence that asymptomatic and pre-symptomatic transmission of COVID-19 is possible, which complicates efforts to pursue case-based interventions. And to reduce this risk, everyone, including people without symptoms, should be encouraged to wear non-medical fabric face masks while in public. They will be most effective at slowing the spread if they're widely used, because they may help prevent people who are asymptomatically infected from transmitting the disease unknowingly. And face masks are used widely by members of the public in some countries that have successfully managed their outbreaks. So at this point, the government is not encouraging widespread use because of the shortages. But in general, once we spin up production and we have more availability of masks, it actually is encouraged as we move into that phase 2 to contain and mitigate the spread of the disease. Mainly to prevent you from spreading the disease unknowingly to other people as opposed to protecting you from others.
Okay, our last question of the night comes from Michael in Versailles.
How you doing, Andy?
I'm doing well, Michael. How are you? Hope you're feeling okay.
Good. I want to start off by saying I appreciate the efforts that the administration has done. They've had to gather up a whole lot of help in fighting this thing, and I know we'll see it through. And that leads me to my question. What does the administration hope to do to revitalize the economy? It's going to be a huge task, but I thought maybe they had some people thinking on this issue. I know we'll beat this. I know with your help we'll beat it. And those people out there listening to this conference, stay strong, stay home, and do the right thing. But I was just wondering if there was any kind of plan, once this is passed or we've got it under control, how we were going to regain that economic engine that we were experiencing.
Well, that's a great question, Michael, and I love your optimism because I share it. This is a huge challenge for our country. I want to thank Dr. Stanton for being on the call, but he gives me hope and optimism because we got talented, heroic people like him and his colleagues in the medical profession and the nurses and the hospitals who are taking care of our patients and putting themselves at risk. But in terms of the economy, I just want to tell you, I think that this roadmap to reopening is what we're following, and I want to encourage you from the standpoint of the economy that we believe this is a second quarter phenomenon. And for those folks who are unemployed and have been laid off, we've just given a great encouragement to your employer to rehire you because they can get a loan and have that forgiven. We obviously expanded unemployment insurance and increased the amount per week to take care of us for the next 4 months so that if you have to do that, don't hesitate to reach out for help. That's why we passed the bill. But we also have encouraged employers to keep people on the payroll and to rehire people they had to lay off by giving them forgivable loans. And keeping those workers connected to employers is going to be the key to a very powerful recovery on the back end of this. Our goal should be to be in a position as soon as possible to reopen this economy, but do so in a way that is consistent with the public health requirements. So our goal should be to get to a place where it's safe from a public health perspective to reopen the economy and getting us to a place where, as Dr. Fauci tells us, where the daily number of new cases are steadily declining. We've pushed that curve down in Kentucky, so as Dr. Stanton said, that might be closer to the middle of May as opposed to 2 weeks from now. But as we see steady declines in the number of new confirmed cases, that's going to get us into the warmer months where we anticipate that this virus is not going to do as well. And by then, by early summer, we anticipate also that there's going to be antivirals and therapies that are doing really well. And so all of this is going to help us reopen the economy. And in terms of the economy, we have just injected into this economy a historic level of stimulus, both monetary and fiscal stimulus, in direct payments, in unemployment insurance, in assistance to businesses to keep the bills paid. We've worked with our banks to give them the ability to modify loans and to provide cash and cash flow to families, households, farmers, businesses. So if you need help with any of that, give us a call. We want to help build that bridge to get us through the next 2-3 months and to get you back on a firm footing. And then by the time this virus reemerges next fall, we will be much more prepared with much more diagnostic testing, a sentinel surveillance system, data collection, more therapies, and a robust way of combating it with a better supply of hospital equipment and personal protective equipment for our folks who are in the medical profession. So with that, I'm going to invite Dr. Stanton to say a final word. And again, Ryan, thanks so much for joining us.
Yeah, I appreciate the time. I appreciate everybody's questions, great questions, and I just want everybody to know that we're out there. We're going to take care of this. This is going to be one of those things that we will tell our children, our grandchildren, our great-grandchildren will live on as what we dealt with this year and how we responded. And we as citizens can do our part to decrease that spread and to take care of our fellow man, woman, and child out there by some social distancing and taking the steps now to prevent this from getting out of hand and overwhelming our healthcare system. I appreciate everybody's consideration, generosity with the healthcare folks. Stay tuned. We are learning about this as you are as well. Hopefully we're going to have faster tests here very soon where we can widespread test Kentuckians and other Americans out there for this virus to kind of get an idea of where it is. But at this point, like I tell my patients, just assume everybody's got it and take the steps to protect yourself, your family, and others with good hand hygiene, sterilizing those surfaces, and then working with your primary care providers if you start to get symptoms on next steps. So, Representative Barr, I really appreciate it. Thanks for inviting me tonight, and thank you, everybody out there, for your great questions.
Thank you, Dr. Stanton. Really appreciate your time. I know you're super busy, and I appreciate you sharing your expertise tonight. And thanks to all of you all for joining the call tonight. Many folks in the queue that we weren't able to get to, and I'm sorry about that, but let me just conclude by emphasizing this overriding point. We will defeat this virus. The world is very blessed to have the United States leading the worldwide war against this insidious virus. Our innovative researchers and scientists are the best in the world, and they're working in a public-private partnership to deliver the best diagnostics, the best therapies, the best vaccines, and we are working overtime to help our heroic healthcare frontline workers and our doctors and our nurses and our hospitals, and we're going to work overtime to find effective therapies to combat the virus. I encourage all of my constituents to continue good health practices for themselves and their families. And again, sorry I was not able to chat with everyone on the line tonight, but there will be an opportunity for you to leave me a voicemail if you would just stay on the line. Please do leave me a message and let me know what you thought about tonight's call. Thanks again for joining us and for the incredible privilege of representing you and fighting for your interests in the Congress. And if you would like to give us a call with help on any of these topics that we discussed tonight, our district office phone number is 859-219-1366. Thanks so much and have a great night.